Hey everyone, it's Dr. Mitchell. It's Friday. Happy Friday. I'm super stoked. The resident's last day is today, and he's bringing in some salmon jerky. He makes really, really good salmon jerky. Dr. Mark, he's going to be an anesthesiologist, probably one of the best there will ever be. He's a great guy. What are we going to talk about today? We're going to talk about keratoconjunctivitis sicca. Say that to yourself 3 times. Keratoconjunctivitis sicca. I'm getting nauseated just saying it twice. What is that? That's dry eyes. Okay? So we're going to talk about dry eyes in an interesting case. Dry eyes, a lot of patients with autoimmune disease get dry eyes. And we tend to think that that has more to do with Sjogren's. What is Sjogren's disease? It's an autoimmune disease that attacks your exocrine glands, your glands that secrete non-hormone things. And the ones that are attacked are your lacrimal glands around your eyes and your salivary glands in your mouth. And along with that, you can have inflammatory arthritis that can mimic lupus or rheumatoid arthritis. You can have a peripheral neuropathy early on, which I learned from a neurologist at some event. One of the really early signs of Sjogren's, peripheral neuropathy. They've got this dry eyes, dry mouth that I talked about. Profound fatigue. A lot of patients with Sjogren's have really, really bad fatigue, and about 30% of them will have that fatigue respond to naltrexone. So if you got Sjogren's, talk to your primary or your rheumatologist about naltrexone. Brain fog and dysautonomia. Dysautonomia, autopilot nervous system screws up, and a key feature of that is orthostasis. When you try to fight against gravity going from lying or sitting to standing, you'll get lightheaded, or if you take hot showers, this will happen. There's all sorts of other maladies that we're not going to get into here. But dry eyes doesn't necessarily mean Sjogren's disease. Sicca signs, dry eyes, dry mouth, they're a feature of a lot of different autoimmune diseases. Lupus, rheumatoid arthritis, Hashimoto's, Ankylosing Spondylitis, Psoriatic Arthritis, you name it. Dry eyes can be a feature, so don't think Sjogren's right away. So this case, middle-aged man, I will say 50s, comes to me, not happy with his primary care, who doesn't think he's giving him enough time and attention, although I think the primary care did a good job, because when I took a history and physical exam, I found out that the primary care was thinking the same thing I did. So this guy has inflammatory back pain. If you don't know what that means, go watch the other video on is your back pain autoimmune. Essentially, pain for no reason, all right? No mosh pits. You weren't hit by a truck. You weren't run over by a train. Nothing fun happened with your significant other the night before. You wake up in the morning and there's no reason for this low back pain and stiffness that goes on and on and on. Okay, so he's got that. His DIP joints closest to the fingernails, they don't puff up, but they hurt. Dry eyes, really bad dry eyes, okay? Fatigue, really bad fatigue, a little bit of brain fog and sleep disturbance. He has restless leg syndrome. So what's going on with this guy? Well, his PCP ordered workup for spondyloarthritis, autoimmune diseases that affect your axial skeleton, and he was probably thinking ankylosing spondylitis, which was what I thought. No infectious serologies for reactive arthritis, no bowel stuff, so no inflammatory bowel disease, no lung involvement or weird skin things or anything on chest imaging findings, so probably not sarcoid. So that leaves ankylosing spondylitis and psoriatic arthritis, but no family history of psoriasis, no psoriasis on himself or funny skin lesions. All right, ankylosing spondylitis probably, or an undifferentiated spondyloarthropathy. Labs were not that interesting. No inflammatory markers, no rheumatoid factors, no ANAs, no B27. Imaging was boring. He had an MRI done of his low back, X-ray of the sacroiliac joints, didn't really show anything, which isn't surprising because this has all come on within the last, 8 months, and it's really unlikely anything's going to appear on imaging. Maybe the MRIs tend to be a little bit more sensitive, but so we hit him with a little bit of prednisone. Fatigue, better. Joint pain, better. Dry eyes, moderately better. Okay, he got worked up by 3 ophthalmologists who diagnosed him with dry eye. Really helpful, guys. We already know he has dry eyes. You diagnose him with dry eyes. But the reason I sent him to the ophthalmologist was to make sure that there was no uveitis, iritis, no anatomic changes to the eye, suggesting that he needs something heavy duty right away. So this is a mild to moderate case, you know, in his symptomatology across the board. But he's annoyed and frustrated, and he wants to get better. And it's a little bit difficult because he doesn't want to do the lifestyle things he needs to do, and so kind of throwing my hands up in the air with this guy. But yes, so the eye specialist said you have dry eye. Apparently, when I sent my notes over, they were ignored, and you know, they didn't necessarily want to jump into the idea that this was a unified thing, despite his response to prednisone. So it's possible that, you know, you can take the Hickham's dictum route and say, you know, he's got inflammatory low back pain, and the dry eyes are a separate issue, you know. Oh, and he also has some cardiovascular stuff, which is really interesting. Irregular pulse, low pulse. Cardiovascular is a feature of spondyloarthropathies. You know, and then there's just fatigue. Everything gets better on prednisone. You know, obviously we can't keep him on prednisone. I do that for diagnostic purposes and helping me sort out what's going on. Everything gets better on prednisone. So this is more likely a unified thing. Let's go Occam's razor on this one, not Hickham's dictum. And the dry eyes. Yeah, it's not Sjogren's. It's part of his, whatever this undifferentiated autoimmune entity is, which is most likely a spondyloarthropathy. The sun's in my face, so I'm going to cut this off now. This is Dr. Mitchell signing off. I hope everybody has a good Friday. Remember, dry eyes, yes, they tend to be a feature of Sjogren's disease, which we'll talk more about in the future, but they can be a feature of any autoimmune disease. Keratoconjunctivitis sicca. Try to say that to yourself 3 times. Don't get nauseated. Bye-bye now.